Hello, if you are watching this, then you are interested in FemiWave. My name is Brooke. I'm a nurse practitioner with Infinity Health and Body, and I am going to try really hard to keep my speech as smooth as possible, but I tend to talk with my hands and talk fast, so I'm going to try to dial it down, so bear with me. So I have my co-pilot here, and we are going to talk to you about FemiWave. What is FemiWave? FemiWave is focused shock waves that will be delivered to the pelvic floor muscle. Why? Because by delivering focused shock waves to the pelvic floor, we are going to strengthen that muscle and we are going to improve the blood flow. So what does that do? The strengthened pelvic floor, the improved blood flow, all of this helps stop that bit of urine that will leak when you cough, you sneeze, you laugh, you run, you hop, you skip, you jump. Added bonus, increased blood flow means better orgasms. So, just throwing that out there and we can see what sticks. The big concern with people when we're talking about getting up close with their nether region is, what does it feel like and where were you touching me? So what I'm going to explain right now, there are a few sites that we have to put the focused shockwave applicator, and those sites would be right above the pubic bone. So if we go here, if there was a person lying here, well, then that would be very weird because they'd have a happy face on their clitoris and their vagina, and that would be very awkward. But person lying down, hip bone, hip bone. Focus shock would be delivered here. Focus shock would be delivered here. Then I would turn down the intensity. So none of this should be painful. To turn down the intensity, go a little lower. The labia majora. So not here, labia minora, definitely not here. That's not my business. We're gonna be here. We're gonna deliver 4 shocks. 1, 2, 3, 4. And that would be the 4 areas we'll be hitting. The final area is the perineal area. What's my perineal area? The perineal area is the area between the vagina and the rectum. So essentially the final shocks are gonna be delivered kind of under this area. And then once that is done, the treatment is complete. What it feels like, tingly, poppy, not painful, should never be painful. Will you have to disrobe? Yes, you'll have to disrobe from the waist down. Will I try to keep you as covered as possible? Absolutely, I'll have you draped, but the fact of the matter is I will be up close and personal in your business, but we will try to keep it as comfortable for you as possible. If there are any questions, concerns, or anything at all, please feel free to ask. I'd happily go over all of this with you in person, and very nice chatting with you. Have a wonderful day.